Hey, this is a simple but valuable test of knee extension and quad engagement. So I'll show the test and I'll talk about why we might use it. So I'm gonna just sit here with my legs outstretched and I'm just gonna lean back and support my hands so I'm not fighting any hamstring or nerve tension. And from there, I'm gonna squeeze my quads as much as I can, try to press my knee into the ground and lift my heels up off the ground. Most people have a couple degrees of knee hyperextension, which means they can push their knees down and the heels come up a bit. If you don't have that, that's okay. We just want it to be symmetrical side to side. So you might only get a little bit of lift off the floor. But what we're looking for in this test is equal performance each side on how much the quadricep engages, how much the knees press downward to the floor, and how much the heels lift or lighten off. And so what can happen with a variety of different knee issues is that we lose this full extension. And when we lose that full extension, the quadricep cannot engage as strongly. The quadricep is one of the most important shock absorbers and muscles that controls and stabilizes the knee. And if we have incomplete quad recruitment, that can cause a host of issues at the knee, hip, even the foot and ankle. And so if this is something I've picked up on an exam with somebody, we look to restore it as soon as we can, but then periodically doing this test. If we're in the early stages, we might do it daily. If we're later, we might do it just once or twice a week, but often we see a painless loss of this test before symptoms start to come on again. And so this can be a leading indicator that something is going on in the knee joint that we want to take a look at. And so I just press the knees down. You can even hold your hands under there if the flexibility allows. And I want to feel equal pressure into my fingers, equal lift off the floor, equal squeeze of the quad. If this is not the same each side, meaning I can get one all the way off the ground, but the other doesn't want to, then typically I want to go to some or several interventions to restore it. And I have ones that I would give on a patient-specific basis, not the topic of this video, but often it's some type of joint mobilization or traction, followed by a specific quad engagement, like a terminal knee extension is what I often call it, with the band at a specific place. But this is a test that's easy to monitor on your own, and I find can give us a lot of valuable insight into health and function of the knees, but it's an easy one to miss because it's often pain-free if I don't have a lot of weight on it, but there can be a clear difference. And so that's the test. And so if this is something I've gone over with you, monitor it as often as daily, but if things are going well, maybe just a couple times a week or before big workouts, big runs, big efforts of activity, because if I'm gonna do something challenging that's gonna use the legs, I wanna make sure I have full quad recruitment during that activity.